Hello, my name is Paula Anderson and I work for Southern Health and I'm the Finance Director. Clearly the start of the financial year for 2020-21 was just as we became aware of the impact that the pandemic was going to have. We could never have estimated that fully, but we started to have a sense of it. So the financial arrangements for the year were changed by NHS England, and the intention of that was to enable as much support to go to frontline services as possible, to reduce the burden around things that they could allow us not to do, but to still maintain a sense of strong financial control. They also wanted to give short-term assurance around being able to make decisions quickly and not being worried about not being able to afford to do that. And they also wanted trusts to have good cash flow so that they could pay suppliers quite quickly, just in case suppliers out there that were helping us to provide food or people or any of the equipment that we need, if they were experiencing cash flow problems, that we wouldn't be part of that. So there were really different arrangements put in place for the financial year, and that had a significant impact on our numbers. I'm going to take you through the key headlines from the 2021 financial position. We were able to achieve a 0.1 million surplus in year. There are some technical things that are non-cash related that we need to carry out that means that the bottom line in the accounts showed a deficit of 2.6 million. But in terms of the way that we are measured by NHS England improvement, we were effectively a break-even. This was slightly better than planned, as it was unclear during the year as to the final levels of income we would receive. As those became clearer, we were able to break even. Our total income was just under 384 million for the year. Most of that came from our local commissioners and NHS England, with a small amount made up from the education and research and development income. Our spend was just under 384 million, of which 72% relates to staff costs and 10% for premises. Cash balances at the end of the year were high at 46.8 million, and in year we were supported by advance payments from commissioners in line with the changed financial arrangements. Just to understand a little bit more of the detail, our income was higher than the 19-20 income by £46 million, which is obviously significant. Some of that was investment in new services around mental health, but the majority of it was to respond to COVID. Our COVID-related expenditure was £17 million, and that included the cost of additional staffing capacity for the increased beds that we opened to help reduce and risk infection or transmission. We needed to work in a different way across all of our sites that minimised people coming into sites, but when they did have to come in, that they were able to do so in a safe way. That meant we needed to make changes to building, changes to the way that people worked, and obviously it included a significant digital acceleration across the organisation. PPE was a big cost last year. It was 3.3 million, and that enabled our staff to practice safely and to keep our patients safe. In addition, there were costs because people couldn't take their annual leave during the year for obvious reasons. We needed staff to be able to carry forward their leave so that they can take it this year, and we needed to financially provide for that last year. That was £4.2 million. In addition, we saw an increase in spend on agency staffing. Some of that was around increased locum doctors, but it was also around additional staff to support services and to support new capacity. Clearly, with the support from NHS England Improvement, we were able to cover all of that expenditure. We were also really careful, though, to ensure that there was good governance around urgent procurement requirements and that we didn't drop any financial controls in year. Where possible, we tried to reduce the burden of the divisions in financial controls and tried to put in extra support from the corporate team. In addition, we minimised our use of external consultants. We spent less than £100,000 on that, and we didn't pay out any sort of compensation payments for loss of offices. We were able to reduce our use of mental health beds in 2021. From a patient care perspective, this was fantastic news, and our teams worked really hard to provide care closer to home. There was also a financial saving that we made from doing so of £7 million, and we had good contracts set up with local providers to be able to provide care when we needed beds that were not within the trust. We didn't make any compensation payments for loss of office, and we didn't make payments to any directors that were not on the payroll. And also the cost of external consultants were less than £100,000. We ensured that we paid people promptly, and I'm pleased to be able to say that 95.1% of the value of all invoices were paid within 30 days. There was no new efficiency target set by NHS England or improvement, but we did try and achieve recurrent savings where possible to support the underlying financial position within the trust, and we were able to do that to the extent of 9.9 million and made further non-recurrent savings of 8.1 million. All of these things and the work that our teams did every day contributed to us being able to achieve a break-even position. The reason why it's important to break even is that it supports the money we have available to spend on capital. And last year was a really exciting year for our capital spend. We finished building Ashford, which is our low secure learning disabilities unit that's on site at Tatchbury. It's a fantastic building, and despite all of the difficulties with building projects last year around how contractors could work and not risk COVID transmission, and also in getting materials, the team did a great job on being able to finish that build, and our patients moved in late summer. We also successfully bid for national funds to reduce our dormitory provision and to increase en-suite facilities in some of our mental health wards. The programme started with work at Gosport and Parklands, and we've been able to make significant improvements to 3 ward areas in the old year, and we continue to do that work this year on Parklands, but also in Melbury Lodge and a 2nd ward at Gosport. As mentioned earlier, we were able to increase our investment in technology, which became really important in terms of supporting people either working from home, supporting our patients remotely via video or calls. In addition, we were able to purchase the MRI scanner for Lymington, which has been installed in the current year, and other medical equipment, all of which helped support us during the pandemic. The final area to think about in terms of our financials is our charity, Brightaway. We're so very, very grateful for everything that people did, both within the trust but also external to the trust, to support funding both directly into Southern Health but also to the national charity, which then was distributed to all. We were able to secure £350,000 last year into Brightaway and used it in the main to support our staff through wellbeing initiatives, equipment purchasing, and also supported local community projects. There were great fundraising activities despite the difficulties within the pandemic, and we really appreciate everything everybody did to support the charity. We also benefited from gifts from many local companies and national organisations. All of those we used to the benefit of our staff or patients. We've got ambitious plans for this year for the charity, and we keep looking at ways to use the grants to enable things like improved garden spaces in our wards and other community projects that can benefit our patients and staff. Finally, just something quickly around our cash balances. These were really healthy last year. Clearly, I've already mentioned the arrangements that were put in place during COVID to give trusts additional cash flow in year, and we were able to use that to support local organisations by paying on time. The final thing to note on this is that you may remember in 1920 we received a loan of £5 million, which we were able to transfer into public dividend capital during the year in line with the national requirement, which meant that we no longer have any loans. Cash balances will always be important, and it is the cash that enables us to invest in capital in future years. To close, I'm just going to talk briefly about the financial position for the current year, 2021-22. As we ended last year, it was clear that we still were facing significant challenges, and further money was made available for health services. Really helpful, and we go into next year probably under the same remit. To just summarise where we are in the current year, we are achieving break-even. Clearly additional funding has been provided to support COVID expenditure, to support hospital discharge schemes where we are able to take people out of hospital quicker and support the acute sector. We've also received additional investment for mental health in line with the long-term plan and the aspirations around mental health services within that. Our capital plan is strong for the year, and despite the ongoing pressures around how you can get people and materials for building works, we've got an ambitious capital plan which includes increasing 2 wards within the trust, which will reduce our use of the private sector. Also has included, and we've finished and completed on this scheme, the installation works for the MRI scanner at Lymington. And we continue to do work in our wards around eradicating dormitories and increasing ensuite bathrooms. At this point in the year, I'm really pleased to say that we're breaking even on a revenue basis. We're slightly behind on our capital plan, but we will recover that during the rest of the year. My final point is a big thank you really to all our teams and members of staff who every day are balancing frontline care with operational requirements, with high quality services, and trying to do that within our resources that we have. And I don't underestimate how difficult that is. Everything that you do every day that helps us have good financial management, that reduces waste, enables us to maximise the amount of money that we can spend on frontline care for our patients. Thanks very much.